Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us again. In this segment, we're going to have a conversation with Dr. Isaac Turner. He's joining us here as co-founder and chief technology officer at Curative. Curative is a next-generation healthcare company that pivoted to COVID-19 testing in March of 2020. He's joining us to talk about the predicament that we're in with COVID still on the rise, with fewer people testing and the challenge of accessing reliable real-time COVID data. He's also going to touch on a little bit about why testing is still relevant and just as important as it was way back in March of 2020. Welcome to Health Professional Radio, Isaac. Thank you for joining us this evening.
Hi, thanks for having me on.
Give us a bit of your professional background and talk about what led you to Curative.
I did a Ph.D. in Bioinformatics and got very interested in diagnostics, especially the new diagnostics that can be developed with next-generation sequencing and some of the really interesting data challenges there are in modern diagnostics and healthcare. Mm-hmm. I joined a startup and really loved the startup diagnostic scene, and that's what introduced me to Fred and Vlad. Together, the three of us started Curative back in 2020.
So how did a small local startup become this national testing provider?
We were originally a sepsis diagnostic R&D company, and we were developing cutting-edge tests to quickly, within hours, discover what was causing someone's sepsis and potentially which drugs might be best indicated to help the patient. Really interesting work. And we were, January, February, and March, watching COVID reports spread. We really saw the writing on the wall when we saw exponential increases in case counts. To most people, it's not alarming when from one day to the next you go from one case to 2 new cases to 4 new cases, and then the next day 8 new cases. But to us, when you really understand what exponential growth looks like, we were very alarmed. We knew that the US didn't have the kind of community diagnostic response ready, mm-hmm. and that it wasn't going to set one up quickly, having worked in that area for a few years. And that's when we decided to put on pause our work on sepsis and do what we could to help. And we had a lot of experience setting up diagnostic labs. We had a good network. We thought we could do something to help. And that's where we decided to move ourselves down to LA and set up a COVID testing lab.
Now, it's my understanding that you've got thousands of test sites across the United States, and you've administered over 32 million COVID tests. And you're still counting, right?
Yep, we're in over 40 states. We also did some vaccinations and delivered over 2 million COVID-19 vaccine doses as well. And I think what made that growth so effective is that we worked very hard with communities to find out how they wanted the response to look, where they wanted testing, and how we could best tailor our response to that community. We have thousands of testing sites in thousands of different locations. They don't all look the same, and I think that's been a very important part of it. It's about working with the community to find out what kind of response they're looking for.
In the introduction, I mentioned that fewer people are being tested. Testing is more accessible than ever before. I mean, you're doing over 32 million COVID tests and counting. Why is testing becoming less utilized, even though it's more accessible?
I think there are a couple of things going on there. A lot of people are still testing with antigen tests. Those numbers don't get reported, and so it's very hard for us to have an accurate picture of where COVID is and who's still testing. I think secondly, people have COVID fatigue. They're vaccinated and they're done with COVID. And I think a lot of that is also reinforced by the media. I think the media are now talking about other issues, other things at top of mind. And COVID as a threat, as a concern for people, it's slipping down the list of things that they can worry about on a day-to-day basis.
Now, you said that antigen testing isn't reported. What types of tests are reported or required to be reported to local healthcare authorities? And why is that data still just as important as it was a couple of years ago?
COVID tests that go through a certified lab are required to report results within 24 hours, both positive and negative, to state health departments. And that gives the states both an idea of how many people are testing and how many of those tests come back positive. and where those tests come back positive, and it gives them some demographics to really understand the behavior and the current phase of the pandemic. It allows them to target resources as well as scale up and down responses appropriately. When that's not reported, a lot of public health departments are now flying blind without an accurate picture of where in the community they need to be standing up their response.
Do you see the future of COVID testing? Do you see testing ramping up, or are people going to become even more complacent with the help of the media, as you mentioned?
I think it's really hard to tell. And what we've learned is that testing volumes are very volatile. We will see very high demand on some days and very, very low demand on others. On our busiest weeks, we've done 1 million tests. On our quietest weeks, we've done about 60,000. And so a lot of that is driven by how much COVID is out in the community, but it's also driven by the narrative and the media coverage of it. And so it's very hard to say. I think if we gave a new name to a new variant, if there was some alarm, some concern that it might cause more hospitalization, I think people would be concerned. But I think what people are now getting attention to is the fact that the effects of long COVID are unknown, and that in some populations with vaccine efficacy waning, there are some risks to some people. And if enough people get COVID, there are some deaths that result in hospitalizations that result from that. And so it's not something that we can completely forget. And that's where I think sometimes people remember that, and I think we see a return to testing a bit more frequently and appropriately. When people have concerning symptoms, they maybe remember to test again instead of going out to a gathering, or test before going to a gathering if they have some concerns, those kind of things.
Home test kits purchased over the counter. What is your understanding as how accurate these tests are, and are they more or less complicated than the tests that you would receive, say, at your hospital or your local clinic when someone else is doing it for you?
I think one of the really important things at curative testing sites, the sample collection is observed, and patients are guided through the process. It's very hard for them to make a mistake at that step. At home antigen testing, it's not the same amount of rigor, and there are opportunities for patients to make mistakes. I think antigen tests have their benefits. I think having tests cheaply and easily available, fast results, I think that's great. They do miss some positive cases, and they're less sensitive than PCR. And PCRs sometimes have a longer turnaround, especially if you're sending them to a lab. We do offer rapid, at some of our sites, rapid PCR, where patients get a result within a couple of hours, and that is a observed collection and has the same accuracy as PCRs that go to the lab. So we're working towards bringing that fast turnaround, very accessible, with the accuracy that people are used to with PCR.
Should we still be just as concerned about comorbidities as we were at the outset of the pandemic? Even though we've got multiple vaccines, we have boosters, and testing is available on every corner almost.
I can't make medical statements, but I definitely think the rates of hospitalizations and deaths resulting from COVID has dropped. But if we allow COVID to maintain high rate of infection in our communities over a long period of time, that really undoes the effect of lowering the hospitalization rates and death rates. It really adds a burden onto the communities. And again, as I said earlier, I think not really understanding the full effects of long COVID, it's definitely a concern where we will see for a few years how that has the impact that is having on our communities and our health overall.
Well, what about any partnerships that Curative has cultivated?
We've recently launched a partnership with TruePill, and TruePill is an online pharmacy network, and we partner with them so that patients who get a positive result from us are immediately connected to a pathway to get COVID-19 antivirals if appropriate, and a connection with the correct screening with the doctor to get those. For us, that test to treat pipeline is really, really important. It's not just enough to know whether or not you have COVID, but also what to do and some of the options available to people. Because I think a lot of people who are getting COVID right now don't really understand all the options and how to access them.
Isaac, is there anything that you'd like to add for our listeners? And then give us a website where we can learn a lot more about Curative.
Of course. I think testing is still as important as ever for those who have symptoms and concerned about whether or not they have COVID, having access to easy, fast turnaround and reliable testing is very important. And that's why Curative is still running thousands of sites across the country with a very simple sign-up process to book an appointment to get tested at curative.com.
I appreciate you joining us here on Health Professional Radio, taking the time this evening, Isaac, and hopefully you'll come back and give us some more information.
Excellent. Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Isaac Turner. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.